scanning the room.
My name is Tiffany, and I'm going to be demonstrating subcutaneous injections with an insulin pen and also mixing insulin using the insulin U100 needle. So I have checked my patient's chart and her labs. I have just spoken with the CNA who had just taken the client's blood sugar, which was 178. So I have assessed my patient for hypo and hyperglycemia. As I was leaving the room, her meal was on its way. So I am now in the med room. I have my doctor's orders and I have my MAR. So the first thing I'm going to do is compare the two to make sure that there is no discrepancies. And I have Shirley Cost 54, Shirley Cost 54, 514.64, 514.64. So the doctor has ordered Practi NPH insulin U100 15 units subcutaneously daily with supper. And we have Practi NPH insulin U100 15 units subcutaneously daily with supper. It's to be given at 5:30. We are at 5:15, so we're good to go. This insulin has an onset of 90 minutes. And then we have Practi regular insulin U100 10 units subcutaneously twice a day. I have Practi regular insulin U100 10 units subcutaneously twice a day, and it is also to be given at 5:30, which we are good on time. This has an onset of 30 minutes. I then have a Practi insulin Lispro U100 insulin pen with a mild sliding scale subcutaneously 3 times with meals a day. Over here I have the Practi insulin Lispro U100 insulin pen, mild sliding scale subcutaneously 3 times a day with meals, and that is also to be given at 5:30, and that has a rapid onset of 5 to 15 minutes, so we'll want to make sure that her meal is actually in the room when we give this. So now that I have performed, or now that I've double checked and there's no discrepancies, I am going to grab the meds, and we have Shirley Cost 514.1964. I have Shirley Cost 514.1964, and I'm going to perform my first med check. So I have performed hand hygiene, and I am now going to pull the medications. So we have Practi NPH insulin U100. I have the Practi NPH U100, and it has Shirley Cost 514.1964, Shirley Cost 514.1964, and I have checked the expiration date and we are good. I am now going to pull my Practi regular insulin U100, and I have my Practi insulin U100, and it is for Shirley Cost 514.1964, Shirley Cost 514.1964. And this one, we are also good on the expiration. Now, because I know that I'm going to have to mix the 2 insulins in a needle, I am going to check my U Central to make sure that they are compatible to be mixed. Next, I am going to pull my Practi insulin Lispro U100 insulin pen. And here I have a Practi insulin Lispro U100, and the expiration date is good. And it also has Shirley Cost 514.1964, and we have Shirley Cost 514.1964. So now that I've performed my first med check, I am going to prepare my medications. I am going to don my gloves. And I am going to get my insulin needle and my insulin pen needle. I've got my tray, and I've got my alcohol wipes, and I have my label. So the first thing I'm going to do is we are going to get the NPH insulin U100, my NPH insulin U100 for Shirley Cost, $514.64. Shirley Cost, $514.64. And I am going to roll this in between my hands because we want to make sure that it is mixed good. And I am going to pop the top. And I'm going to take an alcohol wipe. And we're going to clean the top. And next I am going to my regular insulin U100. I have my regular insulin U100, Shirley Cost, $514.64. Shirley Cost, $514.64. So I am now going to clean the top of this one. After I pop the top. And I'm now going to get my insulin needle. And I'm going to take off the top. And we are going to put air into the NPH first. And because I need 15 units, I am going to draw 15 units of air. And I am going to stick that right in the bottle, not touching the liquid. Can you see that? Mm-hmm. Okay, and then I am going to draw 10 units for my regular insulin of air, coming down to 10.
There we go.
Okay. And I'm going to stick that in the bottle. And now I am going to pull my 10 units of the regular insulin, being careful, trying not to draw any air bubbles. And then once I do this, I am going to have my nurse double check this. Yep. Verified. And checking, we have, just making sure I have no air bubbles, which I don't. I am now going to draw my 15 units of the NPH, excuse me, had to double check that. And I'm gonna be careful not to mix in the vial with the other. So I'm gonna place that in, and then I'm going to carefully flip it upside down, and I'm gonna draw it back to 25. And I've got my 25. I'm gonna have my other nurse verify.
Verified.
And I am now going to recap with the scoop technique, making sure that I grab it on the sides. And I'm going to label my needle. I've got my regular with 10 units, and I've got my NPH with 15 units, my initials, and I've got the date, and I've got the time as 5:20. So we are still good. Okay, so next, put those back. Next, I'm gonna get my EpiPen, or excuse me, my insulin pen. And I'm gonna verify again that I have the Lispro U100 insulin pen, and I have the Practi Insulin Liz Pro U100, and it has Shirley cost 5/14/1964. Shirley cost 5/14/1964. So I'm going to take the top off of this, and I am going to clean this with an alcohol pad. And I'm going to clean this for 15 seconds. And then I am going to get my needle, which is sealed. I'm going to open this up, and I'm going to screw this on, making sure that it's tight, but not too tight, that it breaks. And then I'm going to prime the pen. So I'm going to dial the 2.
Let me see your dial. Perfect.
And now we're going to prime. See it shoot out?
Mm-hmm.
Okay. So since we got it primed, I'm now going to dial up to 2.
Perfect.
Because on the sliding scale, it shows with the 178 glucose that I need to give her 2 units. Okay. So now that I've done that, I'm actually going to write that on her blood sugar that I've got 178 with 2 units. And my nurse has done her verification signatures. I am now going to go into the patient's room after I put my medication bucket away. And we're going to perform our 3rd med check. I have changed my gloves before going into the patient's room. So I come in and, good evening, Shirley, how are you? And I'm going to double check with Shirley her name and date of birth. If you could please tell me your name, date of birth. Shirley Cost, 5/14/1964. That does match on her wristband, as well as Shirley Cost, 5/14/1964. And Shirley, do you have any allergies? Codeine? That matches the wristband, and that also matches my MAR. Perfect. So I know that what we're giving her has no codeine in it, so we're good. I am going to lower her bed rail. Shirley, we are going to give you your insulin. I see that your meal just arrived, so we're perfect. I'm going to lay her back. And I have asked Shirley where she prefers to have her insulin shots, and she says normally at home that she does it in her abdomen, so that's where we're going to do it. Okay, so Shirley, we are going to administer first your mixed insulin, and we will do it right here 2 inches away from the umbilicus. And I've got in the syringe, I have my regular and my NPH. My regular has 10 units. My NPH is 15 units, which matches my MAR. The NPH 15 units, and the 10 units subcutaneous on the regular insulin. So I'm now going to get an alcohol pad, and I'm going to clean the site. And I have drawn a curtain for privacy. We're going to start on the inside, and we're going to work our way around, making sure the site is nice and clean. We are going to let that dry for about 10 to 15 seconds. Okay, so Shirley, I'm going to pinch, and on the count of 3, ready? 1, 2, 3. And doing good, Shirley. Fabulous. Okay. So then I'm going to make sure that I lock my needle, and it goes in a sharps container. Okay, so I'm going to initial off that one, that we gave that at 5:30. And now we are going to move to the other site. Shirley, we're going to give you your EpiPen on the other side of your abdomen, 2 inches away from the umbilicus. So I have my Practi Insulin Lispro U100 insulin pen, mild sliding scale, subcutaneously, 3 times a day with her meal. She has her meal, so we're good. And Shirley, I'm going to give you 2 units because the CNA told me that your blood glucose was 178. So, I'm going to clean the side again. Same way, working from the inside out. And we're going to let that dry 10 to 15 seconds. And I want to double check that I do still have 2 units, that the dial did not move. Okay, Shirley, I'm going to pinch the skin again. And on the count of 3, ready? 1, 2, 3. I heard it click. 1, 2, 3, 4, 5, 6. Perfect. Good job, Shirley. So I'm now going to remove the needle, which already has the protection over it. And we're going to put that in the sharps container. And I'm now going to initial that I had given her 2 units. I am going to sign an initial down here. And now I'm going to double check with Shirley. Is there anything else I can get you? Let me sit you up so that you can eat your dinner. And we want to make sure she's covered. I will let Shirley know that I will come back and check on her in about a half an hour. Make sure she's eating her meal and make sure she's feeling good. In the meantime, I have placed the call button over here. Let her know that if she needs anything immediately, that she can push the call button. And I am taking off my gloves. I have cleaned my area and performed hand hygiene. And I'm leaving the room.